right, Daniel. Thank you for stepping into the podcast. I'm Phil. So give us a little bit of background of who you work for and what you do.
So I work for Lion Healthcare.
Okay.
We're a staffing agency that provides staffing to long-term care homes and retirement homes. And then we'll eventually be moving into hospitals and then home care, where you're moving directly into individuals' houses that want to stay in their own home and provide services like PSWs, nurses, housekeeping, dietary aid needs. So
Incredible. And how long have you been with the company for?
I've been with the company for 5 years. We recently transitioned into providing long-term care services for over the past 3 years now. So
Okay.
it's been good.
Nice. And is it just in Canada, or are you guys across North America?
We just branched out, I believe, to BC. It was like furthest we've gone, but mainly in Canada areas like I want to say the furthest is Temiskaming, Manitoulin Island,
Okay.
and then we have some areas out in Hamilton.
Incredible. Incredible. And now specialties. Like, do you guys, in the area, do you have any special services that you guys offer? Or?
So PSWs, nurses, one-to-one security agents. So one-to-one security agents, it branched off into its own program where you provide a single individual like yourself who has a need and a care for wanting to work with senior living.
Yep.
And you're there to just engage, have a good time with residents, just want a companion, but then also there for the dementia behaviors. So if someone needs that person to want to relate to and connect to, you're that person there because you're working with them every day, and it'll be you and maybe 2 others. We try to keep familiar care very consistent so that you build a relationship with the residents so that it makes the home easier, because if you need someone who needs assistance and the PSW is already busy dealing with 100 other people, you're that individual there to take that stress off. So it kind of works hand in hand with the resident and with the home to bring ease. And then we don't have enough PSWs already, so having those security aids supports that. Then we do housekeeping. We provide dietary aid services where either be server or cooks. And then security in general, because a lot of the homes, they have new builds. Some of the homes want that security presence because, believe it or not, some residents are very strong and fast and they need an actual security guard.
Of course. And have you ever worked, like, it sounds like you know quite a bit about the kind of from the ground up. Is that where you started, or did you come in as a manager?
I started in the security world.
Okay.
So I was a security guard myself. I went to school for social work over at Ryerson University, called Toronto MU now.
Yeah.
They changed the name. And then I just love working with people. I actually started a non-profit where we use exercise as a tool to engage the mind and body.
Wow.
Yeah, so that's amazing. And so it's called Exercise to Success.
Okay. And do you have a website for that?
Yeah, exercisesuccess.com.
Incredible.
Yeah, you can just look it up.
Yeah, and then the company you work for as well, you can plug them in.
lionhealthcare.ca.
Incredible. Thank you so much, Dan.
No worries. I appreciate your time.
Have a good
Thank you.
one.
This was cool.
Thanks.